There's this disease going around lately. It's kind of obscure. You probably haven't heard about it. It's called COVID-19, otherwise called the coronavirus. And I was wondering if we should talk about it. And, well, this is a hygiene channel. This is a grooming channel. It's a health channel. So I thought, yes, we should. So, there are three main things to remember about the coronavirus. It's a virus, so it's spread through microbes. It's spread through water contact, droplet contact, as in someone who is a host for it, coughing or sneezing, can spread it. And it is not airborne. It's not an airborne virus. And so let's talk about the ways to clean it and prepare for it if we can. So here are two main things about the coronavirus you should also know. There's a lot of misinformation in the States regarding the coronavirus. There's a lot of confusion about it. And it's also had several cases on the West Coast. So if you're on the West Coast, this might be important to you. So there's also three ways that we can take care of the coronavirus. Now this right here is a dust mask. Why am I having a dust mask? Well, there are masks for preventing against the coronavirus, and they're out of stock. And this dust mask is just as ineffective as a mask for preventing against the coronavirus. Because the masks that they have bought for preventing against the coronavirus are not actually masks for preventing against disease. They're the kind of mask that you get so that if you are sick in a city, if you were to cough, sneeze, or breathe, nothing that you would exhale would get onto another person. It's meant to keep the disease from spreading. It's meant to keep you from infecting others. It's not going to protect you from being infected. So, if it's passed through by droplets, how can we protect against that? Well, let's talk about it. Alright, so wearing a latex glove is actually going to be very simple. So what we do is we have, let's say, a latex glove. And it doesn't matter what brand of glove you get. It's just good that you get expendable, cheap gloves. You know, the kind of gloves that you get at a doctor's office or a doctor would be having. And so let's say we have one. Let's say we've got a glove right here. And this is going to be your standard latex glove. It's very cheap, very expendable, it's disposable, and you don't have to worry about it. So what we're going to have to do is while our hands are clean, we're going to just slide it onto our hand, like so. And we're going to just wiggle our hand a bit because it's going to get cut in here. And then we just apply onto here, like so. And right here with the rim, we're just going to reach under and pull. And there we go. We have a glove put onto us. We have an assembled glove. We have a way to prevent ourselves from having to wash our hands on a public transport. But what if I want to take this off? Well, very simple. We're going to reach under here. We're going to just pull off, never touching the outside. Same thing goes. If we have another glove on, we're going to just remove like so. Now you want to wash your hands when you do this because when you're doing this, you're going to have some problems. Most people will wash their hands for only 5 seconds. That's not good. It loosens the germs, it loosens the grime. You're going to be more susceptible to disease and filth. So when you do it, what you want to first start doing is you want to just rinse your hand. Like so, we're going to shake so there's less water dripping, so there's less of a mess. Now I'm only doing this with one hand, but when you're doing this, you're probably just going to do it with 2 hands, and you're going to just lather by moving your hand around, and you're going to rub your hands together. So what we're going to do is once we rub our hands together, we're going to keep doing that until we start to see some foam appear, and we want a decent amount of foam. We want to be able to see that foam. And once we're able to see that foam, well, we then want to just start putting it in our hand. And we want the water to be warm. We want the water to be kind of warmer than usual. That helps kill the germs. And while we're rinsing and we're just moving our hands together just to sort of rub off the soap and rub off the germs, you want it to go for 20 seconds. So if you want it to go for 20 seconds, the best way to do it is to sing happy birthday to yourself twice. Or you can just count 1 Mississippi and up to 20. Drying your hands is kind of the same thing in that we got to be careful. We don't want to use, if we're in a public restroom, a blow dryer or a hand dryer because that's usually going to be more filthy. But it's better to use in home just normal reusable towel, even if the other family members have been using it. And we do want to then put it in the laundry and clean it. And either way, if you do want to use a paper towel at home, that can work, but it's not as environmentally friendly or economical in the long run. So that's about it for preventing the coronavirus. There are a couple things you should remember. It doesn't have that high a kill rate, it doesn't have that high a fatality rate. However, that doesn't mean we should ignore it, doesn't mean we are immune to it. And we do have to prepare, we do have to practice hygiene, because if we don't, then it's easier to get the virus. And it still is very lethal to children and the elderly who have weakened immune systems. But I hope you learned something, and I'll see you later.